My name is Dr. Clement Nuka. Today, I'm going to be talking about a condition which is quite common and very serious. That's the reason I'm going to talk about it. It's because it's quite common and very serious. This is a condition caused by a contagious Paramecium virus infection. Its portal of entry, it's by contact first of all, and the upper respiratory tract, because it is carried by contaminated respiratory droplets. And this condition is it's actually serious in underdeveloped countries because it kills children. Well, in developed countries, they use a vaccine to control it. And the name of the condition is measles. And it has been reduced quite a lot by the measles vaccine. In developed countries, they've used this vaccine and it has gone down. It used to be the type of an epidemic that would come after every 2 to 5 years. Get this. But now that the vaccine has been introduced, it has gone right down. But in underdeveloped countries, it's still there. I don't know whether it's because of the absence of vaccination or what. Well, but it is there and it is killing children. What is important to note now, though it is controlled with the vaccine, it is now seen in adolescents, it is seen in adults. The Paramecium virus infection. It starts with a fever. It goes on to conjunctivitis. You look at the eyes, they go red, and you look at there's a hacking cough, and it has got a prodromal phase. It is in the prodromal phase that you see a lot of the greatest communicability. In other words, the greatest infections, because that's when you see patients who are coughing, hacking coughs. That's when you see patients who display anorexia. They just don't want to eat. Patients who display coryzia. Coryzia is a nasal mucosal infection or inflammation. And So you get these patients who display photophobia. They just run away from light. They don't like light. You have to use glasses, you know, sunglasses, and you have uh, to keep them in a dark room because of this. And they need to be isolated because of this infectious nature. Like I say, during this prodromal phase, that's the period of greatest communicability, greatest infection. So these patients, they go on to have, let me see, let's say, the coughing which doesn't stop, the anorexia that is uncontrolled, anorexia, they just don't want to eat. And they're getting weaker and weaker because they don't want to eat. And these patients, when they have this coryza, they sneeze, and that's when they are infectious. And this is stopped. You want to see now, what could be the cause of this? They develop what is known as Koplik spots. Koplik spots, you see them in the mouth. And if you look at the type of, they are always opposite the molars. You know, there's a premolar, incisors, right? And I mean, I'm talking about the teeth, the different types. You know, incisors, premolars, and then the molars. And then opposite the molars, you find these Koplik spots. The Koplik spots are like grayish, bluish coloration of the mucosal, of the oral mucosa. And but then they are marked by this halo, that is a red halo around them. And then these are known as Koplik spots. They can bleed. They can bleed. And Koplik spots, that is the diagnostic feature of this condition. When you see those Koplik spots, that's how you diagnose these. And of course, in the urine, in the respiratory secretions, you know, the respiratory secretions, and even in the serum, the blood, if you're able to isolate this paramyxovirus, that is the measles virus, you're able to isolate it, that's the way you diagnose. You look at the fluids, the urine, and the blood, and in the serum of the blood, you actually can isolate the measles antibodies, you're able to isolate them. And that's the way in which you see that this is measles. So if you look at the fluids will be able to tell you that. And of course, if you look in the mouth, you look for Koplik spots. Koplik spots. But now, what happens? These Koplik spots, something else happens. The temperature goes right up. Normal temperature is for a human being is 37 degrees C. Now, if it gets to 39, 40, and you see now the sloughing off of these Koplik spots, they get sloughed off. And then when they get sloughed off like that, something new sets in. a rush. And this rush, you find it's all over the body. It starts at behind the ears, and it goes to the neck, and it takes the whole body. And this is characteristic. It's lifted up in the skin. It's called macula. And when it takes some coloration, reddish coloration, and we say it's papula. So it's a macular rush. This rush, if it goes right down, it gets to the feet, then you start noticing something. You start noticing that the symptoms actually disappear in the same way as they appeared. Once it gets to the feet down there, they start disappearing. And then now you start seeing that the temperature, like I say, the temperature goes as far as 40. I mean, that's high. Goes as far as 40. And this rush can actually, this rush is pruritic. It's like you have to scratch. You have to scratch. It's a pruritic rush. And it can be erythematous, like it can go red. And once you see this, it disappears the same way as it appeared when the rush starts setting in. And then you see the puffy red eyes. You see the cough becomes intensified, it becomes severe now, the cough. And so the communicability will still go on for as long as the cough is there. And as soon as the rush starts disappearing, the communicability period is getting over now, because the rush is disappearing. And it started disappearing when it went right down to the feet, and it started disappearing the same way as it appeared. And then you start seeing now, the only thing that you're going to see now is your action. What have you done? If, for instance, you have given a gamma globulin is just the antibodies, the measles antibodies. You've given them that. That's called partial immunity. Partial immunity. You've given something that goes against measles, and these are the measles antibodies, and it's called gamma globulin. They're called gamma globulins because this is just temporal. You're giving, this is passive. It's not active immunity. It's not like the body is generating these antibodies. No, you are giving it, and then it goes. It's a temporal sort of thing. It is like the same way as with children. You see, those who are less than 4 months, the infants who are less than 4 months, they have a circulating maternal antibodies against measles, and they are safe. So this is partial immunity. And then you go on to some other kind of immunity where you have measles that has been killed. The measles viruses, they've actually been killed. And then you use that as vaccine, inject that. And if you inject that, you're going to get an atypical immunity. The presentation is going to be atypical. So now you'll start seeing, not the normal way, you'll see fever, and you see, this maculopapular rash. And so it's a mild reaction. It's a mild reaction. It's unlike the Koplik spots that you were seeing and all that. No. It's because now This is atypical condition. It's an atypical infection, or it's atypical presentation of the infection, because because you have given a vaccine, but a particular kind of a vaccine, the one that has got killed measles viruses. They've been killed. Then you inject that. So the type of presentation is going to be characteristic of what you have done. You're going to get now fever, and you're going to get a maculopapular rash. And that's all. That's all you get. That's very mild. And then you go on to get the actual virus, that is the Paramecium virus, getting into organs. And the organ I'm thinking about right now is an organ like the ear. Gets into the ear, and it causes what is known as otitis media. That's serious. Otitis media. Otitis medium is because of the entry of the actual virus, Paramecium virus infection, straight into the ear. If it goes into the lung, you get a pneumonia. If the Paramecium virus gets into the lung, you get a pneumonia. If it gets into the brain, you get an encephalitis, inflammation of the brain. That's bad news. And if that goes on, you get something called subacute sclerosing panencephalitis. In other words, the whole of the brain is infected by this Paramecium. That is bad news, because that one normally kills the patients. It's called subacute sclerosing panencephalitis. The whole of the brain is infected, and normally it's unlike just a normal encephalitis where it entered the brain, but not a part of the brain or something. No, the whole, it becomes. Normally, if the patient is vaccinated with has been given a measles vaccine, the advent of sclerosing, in fact, subacute sclerosing panencephalitis, well, it's minimal. Sometimes you don't get it at all with patients who are vaccinated. What is bad about this one is the fact that you get it if a patient has had measles this year, 5 years down the line, the patient presents with this subacute sclerosing panencephalitis and the patient dies 5 years down the line. I mean, that is why it is so crucially important that we get to vaccinate and make sure, because normally vaccination controls it. I mean, those who are vaccinated, I mean, very few cases are reported of subacute sclerosing encephalitis, panencephalitis. Very few, very few. So this is a way of encouraging people to sort of go for that vaccination. Go for that vaccination. You only have to gain a lot from that, because when the body is capable of synthesizing the antibodies against this Paramecium virus infection and controls it, it's always a good idea. It's always a good idea, rather than to be exposed to Paramecium virus infection without any counter. You don't do anything, and you just hope that I will not be infected. That's too risky. So it's always, what I like about this is the fact that it used to attack every 2 to 5 years. And then in urban areas, for instance, in urban areas, people die. But then now it's not there. Not that it's not there, but it's minimal because there's vaccination. People go to clinics and get this Paramecium virus infection. In fact, the vaccine for the Paramecium virus infection. In other words, for the measles. But that is wonderful. That's one of the best things that we need to. It is quite common. The reason I'm presenting this is because we start seeing it with adolescents now, and we see it with adults. And of course, we have to find out, were these vaccinated before or not? But if they've not been vaccinated, we can still do something. I mean, during the process of, say, during the attack, you can give this passive immunity. In other words, the gamma globulins. The gamma globulins are the antibodies against the measles virus. You give that. It's not going to prevent measles per se or measles attack. It's not going to prevent it, but it's going to reduce its severity. So it's always a good idea to give those. It is going to reduce its severity, which is actually good. I mean, patient was due to die because of the attack. I mean, you have to think of encephalitis. I mean, the complications of it. I mean, even if it's pneumonia is bad news. Pneumonia is bad news. I mean, the patient, he gets a pneumonia, and all the alveoli, as we said, they get consolidation and all that. Pneumonia is bad news. Otitis media is bad news. Encephalitis is bad news. Worse still, subacute sclerosing panencephalitis. No one wants to talk about it because it normally knocks patients and it kills patients. And if this is avoidable, you can do something. You can do something to prevent this. And what is it? Measles vaccine. Go to the clinic, get a measles vaccine. Make sure that it is. All we need to have in mind is that this is a preventable condition, and we know it has got clear signs and symptoms. And the complex spots, that's a diagnostic feature. Let the patient open that mouth and you look opposite the molars. If you look opposite the molars, you'll see those round halos. Those halos, they are reddish. Inside it's blue, the bluish gray coloration. And we call those complex spots. And that's a diagnostic feature of measles. And of course, if you are able to isolate in the nasopharyngeal emissions or secretions, if you are able to isolate the Paramecium virus, and if you are able to isolate even in blood, the serum, you are able to isolate the antibodies against measles, and you'll be able to diagnose straight away. And of course, even in the urine, the fluids, body fluids, the blood, you look for the actual Paramecium virus infection. Thank you very much.